to the Equestrian Queensland Fundamental Series. I'm Tani McCormack, Senior Sport Development Officer at Equestrian Queensland and Director of the series. First of all, congratulations on beginning your journey with your new off-the-track horse. This series has been designed to support you in successfully transitioning your horse from the racing industry, promoting high-quality healthcare and retraining foundations.
We thank QRIC, the Queensland Racing Integrity Commission, for funding this project through their Racing Animal Welfare Grants program. We are proud to support the promotion of life after racing. To follow the full series and for more resources, go to the Equestrian Queensland website and click on EQ Fundamental Series under the Education tab or follow the link below.
Hello, my name's Shane Gillard and I'm Queensland's Racing Integrity Commissioner. I'm pleased to introduce this Equestrian Queensland video series, which has been funded through the QRIC Equine Welfare Racing Animal Welfare Grants Program. Established in 2016, the Queensland Racing Integrity Commission is an independent statutory body which oversees the integrity and welfare standards of racing animals and participants in Queensland. Partnerships are critical to how we work at the Commission, specifically to ensure that the rules of racing are upheld and to safeguard the welfare of racing animals to ensure that everyone can compete on an even playing field. This successful QRIC Rural Grant Program has assisted Equestrian Queensland to develop these educational training videos to demonstrate important aspects of acquiring, assessing and re-educating retired racehorses to prepare them for their first equestrian sport competition. These videos raise the profile of alternative career opportunities for retired thoroughbred and standard bred horses and educate those in the market to purchase a retired racehorse in Queensland.
Hi everyone, welcome to the EQ Fundamentals series, sponsored by QRIC. I'm Anna Minogue and today I'm going to be doing a short presentation on caring for your off-the-track thoroughbred in terms of general health care once they've come off the track.
So one of the first things you're going to want to take note of when your new off-the-tracker comes home is the feet. So feet are an extremely important part of the rehabilitation of any off-the-track horse. A lot of the time they've had racing plates on, they can have very thin soles, very thin walls and very poor hoof health. That is something that your farrier will be able to deal with. And if they recommend x-rays to check pedal bone rotation or not, any of those sorts of structural issues, certainly I would take that advice because you're better off trying to prevent an issue from occurring in the future than trying to fix one that happens. So just pop that up here. So feel free to take a screenshot if this helps as a reminder. So certainly ASAP. If you can get a farrier that's done a lot of rehabilitation of off-the-track horses, that would be very helpful because they will know exactly the things that can be a problem. And we probably want to be looking at initially for trims. Don't be surprised if your farrier wants to come every 4 weeks because there will be a lot of rehabilitation to do. Oftentimes the thoroughbred hoof is quite difficult to manage because they sometimes don't grow a lot, but they need a lot of reshaping. So sometimes your farrier might like to come and reshape the hoof. Probably not put shoes on straight away if the sole health and the wall health aren't great because it will just, your horse will throw shoes in the paddock. They don't have enough wall sometimes to hold those nails in. So don't be concerned if your farrier recommends quite regular trims and perhaps not shoeing until potentially a little bit later. So shoes, maybe later. If your horse has got great hoof health, then you can go ahead and potentially pop shoes on straight away, but do be guided by your farrier's expertise. One of the next things that you might like to take care of with your off-the-track horse will be teeth. Oftentimes when they're at the track or in training, they don't have a regular dental maintenance schedule, and that can be quite problematic for some of these horses. Unfortunately, with our ex-performance horses such as our thoroughbreds and standard breds, they do have quite a lot of breed predispositions to having quite poor teeth. One of those being that we as humans have bred them for certain traits. In the thoroughbreds, it's being run on the flat. In the standard breds, it's obviously being pacing or trotting. So when we breed pre-select for those particular traits, unfortunately, a lot of other things get left out. So feet can be an issue for that reason and teeth can be an issue for that reason. So certainly get your horses teeth looked at as quickly as you can after bringing them home, because I do see a lot of off-the-track horses who do have quite poor teeth and have been on quite a poor dental maintenance schedule and often need a significant amount of work. So the first thing that your equine dentist or equine dental vet will check will be one of them being malocclusion. So malocclusions just mean where the teeth don't match up. Very, very common in our off-the-track horses because they do often have overbites. An overbite is caused when the upper jaw sits too far forward of the lower jaw, and that unfortunately is encouraged a lot as a racehorse in a stable eating from a raised feeder. So when a horse is eating from a height, it can cause some issues with the teeth. So what I would also recommend that you do once you're feeding your horse at home, and this goes for any horse, not just off-the-track horses, feed them from the ground height. It encourages a more normal chewing pattern and also a more normal swallowing and digestive pattern. No horse really should eat from a raised feeder unless specifically, mentioned by your vet. So one of the other things that we'll do is come along and we'll check for these sharp points. So these teeth, you can see the upper molars are much wider than the lower molars, so they do have this shelf that overhangs, and this part doesn't ever get used in the chewing cycle of any horse. So these edges will get very, very sharp as the teeth erupt, and they can cause quite significant injury to the cheek tissue, causing ulcers, cuts, wounds, sometimes abscesses. So those parts need to be filed down to a more comfortable shape so that they don't cause further wounds. Any existing injuries or wounds in the mouth will heal up by themselves once these edges are removed. So I'll just pop dental down on the board as well. So again, with the dental, we're wanting to do that ASAP. And if your horse is under 4 years of age, you're looking at least every 6 months. If older, sometimes you can go to 12 months. But often with thoroughbreds and standard breds that can have quite abnormal teeth, I like to do them more regularly than that. So just be guided by the advice of your dentist. So the next thing that is on our list of discussions is worming. So worming is extremely important. You've got a horse that's come from a fairly, environment where there's a lot of other horses around. They are often, they can be a little underweight when you first get them. So the best thing to do to just make sure it's not an issue is to do some worming. So I would recommend perhaps doing a fecal egg count initially. The fecal egg count will tell you the type of wormer that you should use based on the types of eggs that are in your horse's feces. It will tell you whether your horse is a high or a low shedder, and it will also tell you what your fecal egg count is for your horse. So if it's quite high, you might need to alter your worming program. And if it's quite low, sometimes they don't need as much worming as the high shedders do. So first of all, find the season. Season will depend on the type of drug that you're going to use in your wormer. And then make sure you rotate your wormers. So don't use the same wormer all year round. Most brands have 2 different drugs, 2 different wormers, and they're designed to be rotated. The reason for that is that resistance to worming drugs is quite common nowadays. We don't want to overworm our horses, but we also don't want to underworm our horses. So certainly the rotation is very, very important. If you're not sure, you can contact one of the companies that make the wormers and find out what they recommend. But certainly doing a fecal egg count is very much one of the most important things to do, because then you're not wasting money on wormers, because a fecal egg count generally costs around the same amount of money that a worming tube does. So if you do a fecal egg count, your horse doesn't need worming, you don't need to worm. And then one of our next subjects is going to be bodywork. So sometimes when these horses come off the track, they can have muscle tears, they can have pain. It's a very different way of them either being ridden or driven, the way that they use their body in those sports versus the way that we want them to use their body in equestrian activities. So definitely a good idea to have either your chiropractor, your body worker, your massage therapist, your physiotherapist, your acupuncturist, whoever you feel trusted to use. I would definitely recommend having them come out, give you some advice. Certainly it's very important if you can use a body worker that will write you up a rehabilitation and exercise plan for your horse. That's extremely important in having the horse's body functioning at the best that it can be. It is, like I said, a very different type of exercise. So sometimes we might do some stretches. You might have a body worker that will recommend stretches for your horse to start to use the correct muscles. Sometimes there might be ridden exercises that will be recommended, like poles and things like that. So I like to have a body worker who will give me a bit of an exercise plan moving forward and help me rehabilitate the horse the best way that we can. Also the back muscles, those can often be in a bit of discomfort from just the general activity a racehorse does, driving or ridden. So we'll put down here physical examination. Physical exam by whomever you trust. If you use acupuncturists, have your acupuncturist come out. Everybody has different ideas around the type of people that they like to use. I myself like to use massage therapists, and I've got a physiotherapist that I use as well, and they work really well in conjunction with each other. Some modalities work better for some horses than others. It's just a little bit about trying to see what works and getting the correct advice. So just body worker. If you can find a veterinary chiropractor or a physio who is able to write you an exercise plan and give you the best advice moving forward with retraining your off-the-track horse. So as most of you will know, gut ulcers can be quite a significant problem in any off-the-track horse. This can be due to the boxing of a lot of horses. They're not out in a pasture like perhaps would be best for their guts, but they are in a stable environment. They're also often fed a high energy diet, which can consist of a lot of grains. That high energy diet and high grain diet can cause a thing called hindgut acidosis, which can eventually lead to stomach ulcers. So stomach ulcers occur when the stomach, which is, imagine about the size of a football, is empty. So a horse has to continue eating all the time. Humans and dogs, we only produce stomach acid when we're about to eat. Horses continually produce stomach acid because they're supposed to be continual grazers and eat for 22 hours a day. So if this stomach becomes full of acid and there's nothing in the stomach to buffer that acid, as in to stop it from attacking the walls of the stomach, that's when you can start to get ulcers. So imagine a football about a third full of water. Once you start bouncing that football up, all of that acid splashes around and can cause burns on the wall of the stomach. So those burns can then turn into ulcers and they become very, very painful. So a lot of horses that come off the track have got stomach ulcers. I think the latest studies was something like 92% of all stabled thoroughbred racehorses versus something like 84% of all stable performance horses, so show jumpers and dressage horses. So if a horse goes without food for any longer than about 4 hours, these stomach ulcers can start to occur. So it's really important that we give free choice access to hay at all times. Just a low energy hay is fine, something like grassy hay. And we don't leave our horses tied to the float for hours and hours on end with no food. Because you'll hop on, you'll go to do your show jumping around and there'll be acid splashing around in the stomach. You potentially could cause some gut ulcers. So that's just something to be aware of as any horse owner. But unfortunately, our off-the-track friends are a bit more likely for that to happen. Now, that's something that can be treated. The best way to do that is to consult your veterinarian and they will assess the horse as to whether or not they think ulcers could be an issue. You can get some treatments for those ulcers. There are different types of ulcers. There's ulcers that can occur in the pylorus, ulcers that can occur in the hindgut and the foregut. So those ulcers and where they are will depend on the treatment protocol and the treatment plan going forward. But that's something that your vet will absolutely be able to help you with. So ulcers, question mark. So one of the other important factors with your off-the-track horse is diet. So if you follow the EQ Fundamentals series, Highgain will have some fantastic information for you and they can help you in the more in-depth diet plan for your off-the-track horse. But essentially, we want to increase our horse's fibre and decrease the high energy feed. So the grains, we want to drop those down, increase your fibre. Diet. So lots of fibre. And try and reduce grains and high energy feed. So once we've completed all of these things on our list, we can then move on to the next list. So we'll call this list number 1. This can be list number 2. One of the first things that we'll look at in list number 2 is saddle fitting. Very important. You'll have to bear with me because I can't write and talk at the same time. Saddle fitting is extremely important because obviously once you do start riding your off-the-track horse, you want them to be as comfortable as they can be in their work. So we've done our physical exam. We've perhaps got an exercise program and a rehab program that we've been following. You've been able to build up your horse's top line a little bit. You've been able to stretch some of these muscles out, try and reduce some of the tightness and potential muscle tears that could have been going on when they came off the track. Once all those things are done and your horse is looking healthier, they've put some weight on, the diet is good, we've ticked all of those things off, then we can move down to saddle fit. So I would certainly recommend checking out the talk as part of the EQ Fundamentals series by Catherine, the saddle fitter. She's the expert on this topic and you'll certainly get a lot of good information from her. So one of the next important steps is going to be bit fitting. Some of the off-the-track horses will need some help with bit fitting, others won't. So again, after you've had your saddle fit done, have a look at your bit fitting. So bits, many and varied, just as horses' mouths and the previous training that's gone into that horse. Again, some may not need any help at all and may be completely fine. Others might need a little bit of assistance. So in the racehorse world, there's a very short time frame to get these horses up and running. So now that we've rehabbed our horses, we're ready to go, we have a little more time to try and find out where they're comfortable with the pressure, what they like, what they don't like. We have all these luxuries that we can use to help our horses perform to their best. One of the most important factors when having a look at a bit on your horse, no matter what bit you use, is going to be whether that bit actually fits the mouth or not. So I like to pop the bit in the mouth. The 2 wrinkles rule can apply. Sometimes it doesn't. You just want the bit to be sitting in a comfortable position where when you open the lips, it doesn't bang into the canine teeth at the top. And then it's not looking like they've got a big smile as well. Somewhere in between those two things is usually. The next thing is not to make sure a bit's not too wide. I see a lot of bitting injuries that are caused by bits that are too big. The rider will take one rein and the bit will slide, and sometimes you'll see it slide out of the mouth into about this point, which is where the joints can then pinch on the lips and the cheek tissues and cause quite significant bitting injuries. So certainly having a bit that is quite snug on your horse's mouth is the best way to go, rather than having one that's got this much bit hanging out the side. Because also remember, when you take up the contact, that bit is going to fit quite differently to how it does with no pressure on it. So these are all the things to be aware of. Most of these things you can do at home by yourself. You don't need any additional help. But if you do need help, you can employ the services of a bit fitter who can come out, try a few different bits on your horse, see what the horse likes, see what kind of pressure they like and what pressure they don't want to tolerate, and sometimes think of something completely out of the box for you to try on your horse. But that's the luxury of having all of this time. We can do it all right and get the help that we need. So along with our bit fitting topic, one of the things I'll quickly mention is remouthing the thoroughbred. So the thoroughbred in general and the standard bred, anything horses come off the track, is designed specifically for a job, and that job is to run very fast in a straight line, be it at a pace, a trot, or a gallop. So when we do equestrian sports, we require a completely different feel to the mouth. We require the horse to be soft in the contact. We require the horse to turn from rein aids and body aids. And we also require the horse to have very good brakes because Bag's not doing cross country on a thoroughbred that's galloping out of control. So that comes the remouthing part. So remouthing, which can be very challenging. In my experience of remouthing and helping clients with off-the-track horses, particularly I'll focus on thoroughbreds for this part, they often, the first instinct is to put the horse in a stronger bit because the horse takes the bit, which is what they do racing, that's what they've been trained to do, take the bit, they tense the muscles under the neck and they run. So they feel out of control, they feel as though there's no steering there, they feel as though there's no brakes, the horse just grabs and takes, and it's quite a frightening feeling. So the first thing that people want to do is put a stronger bit on. In my experience, we need to go the opposite way. So the stronger bit just gets a stronger response. So you have a horse that's bracing and it's strong against the snaffle bit, it will brace and it will be strong against a bigger bit. So you put a pelham in it or a gag or something like that. You will get the same response from that horse when you change the bit if you go stronger. What I often find is that these horses have very, very sensitive mouths. Thoroughbreds have got bars of the bottom jaw that are very, very sharp. So these bars here are extremely sharp. I could cut a carrot on those. And they're covered in a very, very, very fine layer of mucous membrane tissue. They have on occasion in the past potentially had a bit hit them there. they get quite sensitive about that. So when we're remouthing our thoroughbred particularly, we need to try and instinctively do what you think isn't right and go for a softer bit. So we will be teaching them rein aids such as turning, becoming soft, but when a horse braces, the first thing it does is it holds through the gullet and it will hold that bottom neck. I call it inverted thoroughbred syndrome because I see it all the time, and what these horses will do is throw their head up in the air, tense the neck muscles and drop the back. And biomechanically, that's quite a bad way for a horse to go around for a long time. It will end up quite lame over time and sore. So sometimes I like to use, and instead of the horse putting its head up in the air, tensing the neck and the under neck muscles, which then holds the shoulders, holds the back end and back drop, I like to put something quite soft in their mouth. This is not to say that you should go out to the shop and buy a really soft bit before your horse has done the training that needs to happen so that they understand breaks, but something like this, which is really flexible. It's quite nice for a horse to gain the confidence back in the mouth and the confidence in the bit that it needs to go into the bit and accept the bit. Once your horse is able to accept the bit, you'll find riding much easier. So you could consult definitely again the expertise of a bit fitter who can come and help you with that. I never put stronger bits in these horses' mouths because eventually your horse will run through a pelham or it will run through a gag. And before that happens, all they're doing is building tension. And you have a tense horse at the end of the range that feels at any moment like it's going to go. We want that softness. We want the horse going into the bit. We want the horse accepting the bit. So bit acceptance is one of the first things with the off-the-track horses that I like to work on, and trying to make the experience much more comfortable for them, and something that they look forward to instead of try and avoid. Keeping in mind too, once we've done all of these things, this is going to be continually a healthcare plan for your off-the-track horse. So you may find yourself needing to come back to have a body worker out perhaps. The work that you're doing, you're changing the way that the horse is moving. The entire biomechanics of your horse is now going to be quite different, and you may need to continually seek the professional opinion of a body worker or a chiropractor or somebody who can help you keep your horse in tip-top shape. We may end up having a look at some ulcers again in the future. We may end up having an old injury perhaps that your horse had when it was on the track that may resurface under more pressure and more work. So just be aware of these things always needing to be in the forefront of your mind. If you have any issues with your off-the-track horse, do seek professional help, and best of luck with your journey on your new amazing off-the-track horse.